Hi, Dr. Lorne Brown here from AccuBalance Wellness Center, and I want to talk about using photobiomodulation, also known as low-level light or laser therapy, on the brain. Sometimes patients have asked when I'm using the laser and the LEDs on their head, how's this going to help their fertility? And in actuality, a lot of fertility is related to your head, and some refer to the brain as the master and commander of the body. And when we think about reproduction and for fertility, think of the brain's role. So, the hypothalamus has to release gonadotropin releasing hormone, GnRH, to go to the anterior pituitary. And that releases your follicle stimulating hormone, which then goes and communicates to your ovaries to tell your follicles to grow each cycle. And then when you're that mid-cycle around ovulation, the brain has to release luteinizing hormone, LH, the hormone that you may be testing when you urinate to see if you're going to ovulate. Well, that's LH, and that comes from the brain, and that is meant to help with the final maturation of your follicle or follicles, and also it's needed for the follicle to be released into the fallopian tube. And so the brain does have a lot of a role to play, and so it kind of makes sense that we would be using tools like photobiomodulation, low-level laser therapy, to create a healthy brain, a functioning brain. And in recent years, transcranial brain photobiomodulation is showing some promise for such conditions as fertility, anxiety, depression, and post-traumatic stress disorder, dementia and Alzheimer's and Parkinson's disorders, and other traumatic brain injuries such as stroke and concussions. Now, since our brain plays such an important role in our well-being, mood, and fertility through our hypothalamic pituitary adrenal axis, so the HPOA axis, which includes your thyroid, your adrenals, and your ovaries, it seems to me it's in our best interest to have a healthy brain for general quality of life and obviously for improved fertility. So I've been using for several years now low-level laser therapy, photobiomodulation to maximize embryo quality through optimizing both egg and sperm quality and that uterine receptivity. And I've learned now that by applying low-level laser therapy to certain areas of the body or certain laser acupuncture points, we're able to help support your fertility and overall well-being. Currently, in my comprehensive approach that I've been using in our updated Laser Baby program, I'm targeting the areas for the brain, so brain with photobiomodulation, looking at the gut microbiome, using it to trigger the vagus nerve and other target areas to elicit that parasympathetic response, that relaxation response. Obviously, the ovaries and lymph nodes that target the ovaries, arteries to increase blood flow to the brain, to the ovaries, and to the uterus, and even nerve roots that come from the spine that go and innervate your uterus and your ovaries. And I kind of want to discuss basically the brain photobiomodulation, like why the brain? So as I mentioned, the brain already has an important role in reproduction through the hormones that are released to trigger the growth of your follicles, follicle stimulating hormone, as well as luteinizing hormone for the maturation and the final rupturing, ovulation, release of that egg. In general, though, we also want just you to have a healthy brain. Like so many of our patients, the stress of infertility, we know from some research that extreme stress related to infertility can slow down the time to pregnancy and natural cycles. And also there is a large dropout in IVF cycles due to the stress. And so some women, if they just did that second or third cycle, might have had a take-home baby, but they dropped out because of the stress and never made it to that IVF cycle. And so who doesn't want to have a general well-being? Who doesn't want to feel good? And so it made sense to add the brain photobiomodulation to our approach with the intention that we're going to optimize fertility, but we're also going to help optimize your mood and well-being. Now, I had an opportunity to discuss altered states of consciousness using brain photobiomodulation with Dr. Sanjay Manchanda, and he's a licensed psychotherapist and a mindfulness teacher. And we got to discuss his presentation that I got to watch called Altered States in Photobiomodulation, Other Extraordinary Observations in Brain Photobiomodulation. And what Dr. Sanjay Manchanda observed by pulsing near-infrared light, so certain frequencies of near-infrared light on the skull, that it actually entrained the brain, which they measured using EEG, which is a test to detect electrical activity in your brain. And they observed how there was physiological effects and changes in altered states of the mind, such as increased energy, body awareness decreased, arousal increased, focus increased. There was an increased self-observation and equanimity, and there's just an overall joy, feeling of joy, feeling of expansion. And so, again, this whole idea of just seeing our patients start to have that relaxation response and not feel so stressed and worried and anxious, to me is already a value. And then since the brain has such an involvement being a master commander of the body, to have that healthy brain seemed like a great approach to add to our Laser Baby program. So that is why sometimes you see us lasering around the skull or using certain devices, LEDs and lasers with different frequencies on the brain, with the idea to help with that altered state and to help with just a healthy brain function. So not only do you feel more joy or optimism or calmness in your life and focus, but also that your brain is doing its job of releasing follicle stimulating hormone and luteinizing hormone at the right time. Anyways, I hope you enjoyed this short little chat on laser for fertility, in particular on brain photobiomodulation. And do check out some of the other videos and blogs we have on using our Laser Baby approach, on how we're using it to affect the gut microbiome, how we're using it to affect the relaxation response through the parasympathetic nervous system and vagus nerve, how we're hoping to increase the mitochondrial function in the ovaries, so the mitochondria are like the batteries of the cells, and to increase blood flow and regulate inflammation in the body as well, all with the goal to improve overall well-being and increase and maximize egg and sperm quality and uterine receptivity. Thank you very much.